Hi, everyone. Welcome to today's Career Chat. I'm Krista Harmon. I'm one of the Career Readiness Consultants for the Kent Intermediate School District in Grand Rapids, Michigan. And I'm really excited to welcome Kristy Todd. She's a nurse practitioner and actually has a different role even in management in nursing at Mercy Health here in Grand Rapids. So welcome, Kristy.
Hi, everyone. Nice to be here.
Well, I'm really excited about this 30 minutes to hear about your career path. And to get us started, I know the students love to hear what were you thinking back in high school, Kristy? Is this what you thought you'd end up being an administrator in the nursing field? Tell us about those early days.
Well, I've always said that I knew I always picked the best career ever in nursing because I've never ever woke up one day and have ever dreaded going to work in 32 years. And my first recollection of wanting to be a nurse, my mom reminds me of, was when I was like in third or fourth grade. She said that's all I talked about is that I wanted to be a nurse. And my only exposure to nursing at that time was office nursing. So when I would probably go when I was sick, I really didn't understand hospital nursing, but I knew that doctor's offices, as we used to call them, used to have like a really clean smell to them, and everyone was so nice. And the nurses to me were always so kind and smart and helpful. And I knew from in elementary school that that is what I wanted to be, and literally went from high school to a nursing program.
So were you in high school, did you like science classes? Was that kind of fitting you then all the way along?
I did. That's kind of funny that you ask. I've always enjoyed science, and that's where my strength is at. So in high school, biology, and I loved lab. I liked chemistry, though I struggled in chemistry, and I struggled in chemistry all through even in high school and then undergraduate. So those first, 2 to 4 years of college education. But I always enjoyed biology, pathophysiology, always loved that, anatomy and physiology. Wasn't so bright in trig or geometry, even though you kind of have to be good in math to be a nurse. But that didn't come as natural to me as sciences.
And I think that's important for young people to hear that, it's not always easy, like you're going to sail through these classes, that it's okay and to kind of grind through some of that science to get through the other side. Oh, I love that. Pathophysiology. So young people write that down and Google that later, find out what that's all about. That's a new word for me. So you graduated from high school, and so you knew, man, I want to be a nurse. It's been something you wanted to do since you were a little girl. How did you choose what school you were going to go to, and what school was that, and what was that program like?
So I was very fortunate. I was one of 5 children in my family, and none of them completed college, nor did my parents. My father was actually a 10th grade high school, I hate to say dropout. He was raised back in the 40s and 50s on a farm. And so he was not given the opportunity to go to college, and nor was my mother. They were both very successful and had done very well in their lives. But it was something that my mom and dad always wanted us girls to complete. I was very fortunate that, and it's kind of sad, I say, that even though college was offered to myself and my other 4 sisters, just due to some of their own personal decisions, they never completed. And I was able to go to away to school where my sisters, they were offered to go in the local community. So me being the baby, maybe my mom and dad thought that they would offer me to be able to go to other schools. I was fortunate that my mom helped me get connected through our high school counselor to talk about what are good nursing schools. So now we call them nursing programs, but back in the day, we called them nursing schools. Between the counselor and my mom, they identified a couple schools that were local, and I grew up in Northern Kentucky. And so found a couple schools there, and then also a school that was about 2 hours away from home called Eastern Kentucky, and very kind of similar to a Michigan State. So it was a big school, and it was a school that all the seniors want to go to for other reasons besides academia. So all of you young kids, you know what I mean. It was fun. People would have a good time with, in addition to studying. So anyway.
Good parties, good college parties.
It was good college party. And I applied. I barely got accepted into the nursing program because my formal testing scores, so like your ACT or SAT, had the bare minimum to get into a nursing program. I say this, you guys, because I think, nursing programs are really hard to get in and they're really hard to make it. But I wasn't this top kid in my high school that breezed through high school. I studied real hard. I was in the honor society, so whatever that is, the top 10% of your class. But I tell you, I had to study. And on top of it, when you ask about my strengths in sciences, my other strengths and my weaknesses per se were like in English and reading comprehension. So when you take those formalized tests, unless it was the science portion, and I probably did okay in math, but I barely made it in, and I got in. So I got into the nursing program. Believe it or not, it was a 2-year associate degree nursing program that was offered at a large university. Most places that offer 2-year associate degree of nursing programs are at community colleges. This was offered kind of like at a Michigan State. And so I got accepted into that. My mom and dad warned me, I had 1 semester. And if I didn't pass, I was coming home. I wanted to be a nurse. I wanted to be at that college. So just like high school, I just studied really, really hard. And I did okay my first semester. Wasn't easy, but I did okay.
So that college program was what I want young people to know is called a direct admit. When you went to that college, were you automatically in the nursing program?
Yeah, so pretty much the same way it works now. You apply to the college, the major university. So you would apply to Michigan State University or wherever. And then you have to apply to a specific program, whether it be a nursing program, a business school, or you had to do like a sub application for that. So I was fortunate that at the same time I got admitted into the university, I was also admitted into the nursing program, which I understand doesn't always happen now because it's so competitive to get into nursing programs. I was fortunate, you guys.
Yeah, so I want young people to understand that some colleges are a direct admit. So when you apply to that college in the nursing school, when you get admitted, you're automatically in that nursing program. And so if you have a little bit of a rough first semester, like Ms. Kristy was saying, it's okay because you're already in the program. Where if you're not in a direct admit, that first semester is part of your credentials now to be able to get into the nursing program. So I just want to let you know there's differences, and it depends on the college that you're applying for. So depending what kind of student you are or what opportunities are out there that you want to pursue, that there's a little bit of difference. Anything you wanted to add to that, Kristy?
No, Krista, I really am glad that you clarified that, because this makes a difference. Not only, and not just in a nursing program, you guys, but it really makes a difference, because if you don't do good first semester and second semester, it's hard to catch up. And you are constantly going to be, you can catch up. Don't think that you can't catch up. I don't want you to think that, God, I messed up. I had a bad first semester, freshman year, college is out for me. Don't ever give up. I'm not saying that, but it is important that that you do just try as hard as you can that first semester, freshman year, and take it so serious. You'll have your whole life to party, I promise you. There'll always be parties. I'm 53. I still can do that, but I wouldn't be able to afford the life that I have if I didn't go to nursing school and finish nursing school.
Yeah, so for young people, it's so important to get those tutors right away and, like you say, balance, because going to college is a big adjustment. period, you know, because you're leaving your parents' home for the first time. So anyway, just, I love that advice. So
Yeah.
just for students, you know, they might have an idea of what nursing is, just from their own experiences going to a hospital or a doctor. I don't want to spend a lot of time in this because they can research this, but give just a quick synopsis of what being a nurse is. And then we're going to focus in on that nurse practitioner part.
Yeah. So the biggest thing about being a nurse, and I think when you think about being a nurse, it's a combination of art and science. But the biggest thing about being a nurse, no matter what degree you get, no matter what field of nursing you go into, and we can talk about that in a little bit, being a nurse is serving others. It is being there to help support patients and meet patients where they're at. In the big scheme of things, in big fancy words, it's about doing accurate nursing assessments, obviously like listening to lungs and belly sounds and listening to the patient and how they're feeling. It's about making understanding appropriate nursing diagnosis, like what's happening with the patient. It's about meeting the needs of patients head to toe, psychosocial needs down to their physical needs. It's being an advocate for patients, listening to what they need and being their voice when they either don't know what questions to ask, or they're afraid to ask, or they feel stupid to ask, or they're too weak to ask. It's about being there for them. And we can talk about the wonderful field of nursing on so many things that you can do, but truly being a nurse is serving others, being their advocate, and meeting every patient where they're at. And that is a big bucket of where a patient is at.
So, and that's what I love about career chats, Kristy, is as students hear what you just said, they can start to self-assess, like, does that sound what I want to do? Do I want to be that person for these patients? And sometimes it's a no, and maybe they'd rather be on behind the scenes. We heard from a laboratory supervisor last week, and sometimes you can be on the behind the scenes in healthcare. So I love that way you describe that, so kids can start deciding for them. Right. So young people, yes, go ahead.
Just add, I mean, obviously in nursing, you give medication, you bathe people, you start IVs, you manipulate medications in the ICU to keep people alive, you console people at the time of their death, you can be a part of delivery of a baby. There are so many different things you can do in nursing. But I think when people think about a nurse, I think they think about us at the bedside, taking care of patients and giving medications and that sort of thing. But there's a whole lot more to it.
So I'm going to ask a question that the students haven't asked yet, but it comes up a lot when I talk about nursing. And then we're going to move on to the nurse practitioner part. What if a student already knows they don't like blood and guts? Can they not be a nurse then? Do they need to find something else?
There are no. There are so many, and I have so many friends that can't stand blood or needles or poking patients, or there are so many people that say, I could never do this. In nursing, you guys, you can do so much. You can choose to be a nurse and work in an office practice. You can be a nurse in home health care. You can be a nurse and work behind a computer, nursing informatics. You can work in a mental health institution or a mental health hospital where there is no poking of patients or exposure to a lot of blood and body fluids, but you're just talking to patients a lot. So it's okay. You will be exposed to a little bit of blood and needles while you're in the nursing program, but if that's absolutely something that freaks you out, it's okay, because the field is so broad.
I appreciate you sharing that, because I hear that a lot, because sometimes students think, well, I just can't be a nurse then. Because I'm a big proponent of the nursing field. I think for a 4-year degree, it can take you so many places like you just outlined. Mm-hmm. I really want young people to consider it strongly. Yes. So young people, we're going to have some other career chats this next week or two of other registered nurses. So I'm not going to spend a lot of time on that, because we're going to talk more about that. But I really want Kristy to talk about a nurse practitioner, because some of some of you may not know what that is. And I want you to understand that there's a career path with nursing. And then I'm going to come back to some of the questions that you guys are putting in the chat room. So let's let Kristy just give us a big picture of what a nurse practitioner is and how that's different from a registered nurse.
Yeah, so that is really a great question. So a nurse practitioner, and by the way, sometimes people get nurse practitioner confused with licensed practical nurse or LPN. So a nurse practitioner is a what we call an advanced practice nurse. So if you were to go Google advanced practice nurse, you're going to see 3 other roles that are considered advanced practice. So Krista, that might be something you might want them to do. But when we talk about a nurse practitioners are what we call masters prepared nurses. So we went to school beyond our undergraduate, our bachelor's, to a master's program. And that's normally an additional 2.5 to 3 years of college education, where you have not only didactic book learning, but you have advanced clinical placement where you spend time in an office setting or at a hospital working directly with other providers. So physicians, physician assistants, and other nurse practitioners to get advanced assessment skills and clinical assessment skills. But you also can do things such as prescribe medications. You make medical diagnosis. You prescribe medications. You order diagnostic tests. So I can order and interpret chest x-rays or x-ray of your knee to say if your leg is broken. I can order treatments. So that's the difference between a registered nurse and a nurse practitioner. Nurse practitioners are what we call advanced practice. And we are, the simple part is we are able to assess, diagnose, provide medical and nursing treatment options. And we can order laboratory and other diagnostic tests. Registered nurses cannot do that without speaking to a nurse practitioner, physician assistant, or a physician. We take registered take orders to do that. As a nurse practitioner, I can independently see patients.
Thank you so much you did a great job describing that, because some young people, they may have already heard about physician's assistants. For those of you young people that haven't, it's not a doctor, but you get to prescribe medicine, authorize treatment, order tests, just like Kristy just said. But a lot of young people, a lot of people aspire to be a physician's assistant, but They don't know that a nurse practitioner is another option. So they're very similar in a lot of ways, but why should someone consider a nurse practitioner over a physician's assistant, Kristy?
Yeah, so of course I'm a little bit biased toward being a nurse practitioner, mainly because of the way that nurse practitioners are trained versus physician assistants, how they're trained. By the way, I see a physician assistant when my primary care provider is unavailable, or just if I need to get in. So I trust physician assistants. They're amazing colleagues of mine. But the question is, what is a true difference in that? So nurse practitioners, the way we are trained off of what they call a model of care, which is about health maintenance and disease prevention. Physician assistants and physicians are trained what they call the medical model. It's about treating the sick. Why it's so important to me as a nurse practitioner is because I'm a family nurse practitioner, and you'll learn there's different ways to become a nurse. There's different programs. You can do family nurse practitioner. That's from pregnancy up to the older adult, the geriatric. You can be a neonatal nurse practitioner. You can be a geriatric nurse practitioner. But being a family nurse practitioner is very important to me because of the whole disease prevention thing. I would rather talk to the 22-year-old about sexually transmitted infection prevention so they don't get cervical cancer down the road. I would rather talk to a 40-year-old patient about hypertension management and diabetes management, because I don't want them to have a kidney transplant or lose a limb 20 years from their diabetes diagnosis. That's disease prevention. And health maintenance is, if you think things about getting a vaccine for coronavirus or the flu or HPV, that's primary prevention. So that, to me, is what I like about the nurse practitioner model. Also, the way we are trained, very holistic. It's not just physical illness. It is about emotional health and mental health. We know that impacts physical health. And I think in the last probably 15 years, nationally, we've been talking about that a lot. Nurse practitioners have always been trained like that. And it was a natural transition for me to go from nursing, registered nurse, into nurse practitioner. There's only one school in the entire country, I believe it's Vanderbilt, that lets you start from high school into a nurse practitioner program. Most programs are 4 years undergraduate nursing bachelor's degree, then you move into a master's program and or / doctorate program. I'm doctorally prepared. So I have my doctorate, but I got my doctorate after I became a nurse practitioner. But there are some programs, and I think in the next probably 10 years, it'll be a requirement for all nurse practitioner programs to move to a doctorate level, like they do with nurse anesthetists who put people to sleep.
So you have a PhD, so you're Dr. Todd then?
I am Dr. Todd, but you can call me Kristy.
I love it. And
yeah.
I really
actually, just to clarify, Krista, there's many doctorates.
Right.
I have something called a Doctorate of Nursing Practice, DNP. PhD is research. DNP is more of a clinical track of a doctorate degree. And it really helped me learn more about being more of it helped me more in my administrative job to get that doctorate and to understand how healthcare works.
So one of the reasons I was so thrilled to have you on today is because I really want young people to understand that potential career path. You know, that, I mean, a 4-year degree in nursing is solid. It provides you a wonderful career and you never have to take another bit of education. But I want young people to know that for those of young people that aspire to advance, they already know they want to get advanced degrees and make more money, that this is one of the paths. I know the students, though, at this age are really interested in some of those next steps, Kristy. So one of the questions in the chat was about advanced classes. And I know you took your high school schooling,
Yeah.
you know, a little bit while back, but what would you recommend for young people to be taking in high school from what you know as for the young nurses that you're hiring around you?
Yeah, so, you know, in high school, I was fortunate enough, and I went to a community high school. I didn't go to a private school. I went to Boone County High School, if that, can you imagine that? And, but we were, I was able to take what they call advanced placement classes. Many of you may know AP classes. You guys, how I got so lucky to get in those, I don't know, because again, you guys, my mom and dad were just normal people. I love them. I think they're brilliant, but it wasn't like I was raised my entire life with these, you know, an astronaut and a neurosurgeon saying, Kristy, you're going to be a nurse and you need to take all these classes. I literally was fortunate enough that I enjoyed the sciences. So I tried to get in advanced placement classes for biology and chemistry. And I have to admit, you guys, being in advanced placement classes, if you can get into those, get into those. You're going to be around a bunch of really good kids that want to learn as much as they can. And the teacher can spend the majority of the time teaching and not trying to control the class. And they can truly help you. So I would say, you guys, if you can take classes that are strong in your sciences, anatomy, chemistry, biology, those classes in high school, you guys, will set you up for success in your college science classes. And remember, I said I didn't make I didn't make A's in all of those classes, you guys. I actually was a BC student in high school.
Yeah, I really appreciate that. The bottom line is, you guys, the colleges are going to be looking for what rigor you are doing in high school. So that is another reason to take the highest level of sciences that your school offers, so that you can show the college the rigor that you've done. So it is really important. Obviously you would recommend anatomy if that's available at their school.
Yep, anatomy. Yep.
Yeah, for sure. We only have about 3 minutes left, Kristy, but what would you say are your personal strengths, but what are those strengths and weaknesses? And obviously weaknesses, we don't have to focus on that too much for you, but you did mention that reading comprehension was one of your weaknesses in high school. But what does it take to be a good nurse and nurse practitioner? What are some of those strengths that young people can maybe hear you talk about to see if they have that?
Okay, non-judgmental. You will take care of people that have raped people, committed a crime, who cuss at you, who hit you, who are drug addicted. Meet them where they're at. Give unbiased care to patients. That is the biggest thing I can say, and learn. And if you have a desire to serve people and care for others, you guys, every day, I said this, I've been in this field 32 years. When that alarm goes off, I have never said, oh my God, I got to go to work. I've always loved what I did. And I am grateful and privileged to be a nurse. And when you work hard and you work an 8-hour shift or a 12-hour shift, and you give that patient everything you can, and they say thank you. And I get very teary-eyed, because when you're an administrator like I am now, you don't get thanked as much as a so-called nurse. But I'm telling you guys, it's the most rewarding profession in the world, and the opportunities are endless. And whether you stay at the bedside for 40 years and be the best ICU nurse or OB nurse, or that's fine. You don't have to go get your doctorate and be an executive. You be the best nurse you can be and just serve others.
Awesome. I'm sold. I wish I could do it all over again. I'm going to share a screen with the students, Kristy, to give them a resource. They can do more research about your career. You can think about a final word of wisdom. I'll be back in 30 seconds with you. Let me, so you can think about what you want to finish off your talk. A little word of wisdom here. So young people, this is a website to search about different health careers. You can read more about nurse practitioner and nursing. And what I love about myhot.org is it also shows Michigan schools in their health programs, okay? And they have a little quiz you can take, which might help kind of direct you to one of the health careers too. So it's always fun to take those kind of free assessments. So myhot.org. And then I've mentioned this to students in past career chats, but ONET Online is a fantastic career research website. If you haven't been in it already, young people, I really encourage you to do it. I did a screenshot again of nurse practitioners. And again, as you see, there's other titles for what Kristy does. And so then you can start to really educate yourself about opportunities out there, start to Google some of these terms, but this site itself really offers you everything you need to know. These are some of those tasks that Kristy didn't get too far into, but she gave us a good overview. You know, what kind of education you need, what kind of job openings are out there. You're gonna learn about wages, because I know everybody wants to know how much you make. So again, check out ONET Online. It's such a great website. And Kristy was kind enough to say that if you had any follow-up questions, she's welcome. She said that she would invite an email for those of you that are fine-tuning your decision-making, especially those that are seniors. You know, she is now part of your network. So Todd KM at mercyhealth.com. And again, my email, which I can always connect you to our role models, is Krista Harmon at kentisd.org. So we're up out of time. Kristy, what's that final word of wisdom?
Last, don't ever give up. There are so many resources out there for you guys. Please work with Krista and your counselors, and just if you have amazing parents, that's super too. But don't ever give up, and always ask and keep asking and ask for help, and don't let anything be a barrier. Don't let money, don't let transportation. There are so many resources out there that can help you. Don't ever give up. You will always have a job in nursing. You will make good money. You can make as much as you want. And sometimes we don't let our nurses work as much as they want to work. But you guys, it's an amazing profession. And just please reach out to me, because as you can tell, I love to talk about nursing and healthcare. So the best of luck to all of you. Hang in there, and only you are stopping you.